Could Borrelia burgdorferi persist in the brain just like syphilis and drive late-stage neuropsychiatric diseases?
The information shared on the Rethink It podcast is intended for educational and informational purposes only and should not be taken as medical advice. While Dr. Sande is a licensed medical provider, the content of this podcast is not a substitute for professional medical diagnosis, treatment, or advice specific to your individual health needs. Always consult with your healthcare provider before making any decisions related to your health or medical care.
Welcome back to the Rethink It podcast, where we challenge what you think you know about brain health, longevity, and healing. We are not here to chase symptoms or hand out quick fix band-aids. We're here to ask better questions. We're here to rethink pharmaceuticals as the first answer, explore cutting-edge natural sciences, and most importantly, we are here to employ you to partner with your body's innate healing wisdom. So today's episode is going to be a little different. We're going to do a deep dive into something that you've heard me talk about a lot. Now, Lyme is the reason I do this podcast. Lyme started this whole thing. My son got sick with Lyme. Get his book. It's around here somewhere. My son's Lyme disease story. The reason I am here talking to you at all today is because he had a significant problem at the age of 7, 8, 9, with Lyme disease. It was severe. It was debilitating. You couldn't get out of bed. If you're a Lymey, then you probably can resonate with that, especially if you've had severe advanced Lyme disease. And so we're going to talk about something that's considered relatively controversial in the conventional medical space, and that is chronic Lyme disease. And we are going to explore the impact on brain health and the studies. We're actually going to go into the literature. Now, I am doing this podcast because one of my faithful readers actually emailed me this podcast. She emailed me this study. Now, I've seen this study before. It had been a while, but it got my creative juices flowing. So all of you who are engaging in this podcast, sending me emails, dropping comments, all those things, sharing the podcast, you guys are amazing. And thank you for giving me more content to work with. So we're going to do a review of that study. We're going to look at it. I'm going to summarize it for you. And I'm going to look at the literature that's been updated since that study came out, because that study was from, I believe, 2012. So what we're going to review is a study that actually explored, it was considered landmark at the time. It compared Lyme neuroborreliosis, that is a fancy term for neurologically impacted Borrelia, Lyme bacteria, in the brain, okay, and the nervous system. It compares it to, not Lyme borreliosis, to neurosyphilis. Neurosyphilis. You heard me right. The STD. Okay. We're also going to look at the recent studies, like I said, that have shaped that thinking and expanded on that study. So that is what this podcast is about. So if you have somebody you love that has ever dealt with like Lyme disease, brain fog, unexplained mood changes, lingering symptoms after Lyme, this episode is for you. So let's go into this study. The study, and I'm going to put it up somewhere in here. We're going to have my people put it up in here so you'll see it. The link will be in below so you can open it yourself and read it if you'd like. It was published in 2012. It was a review comparing Lyme to syphilis. So back in 2012, Dr. Judith Miklossy published a review in the Open Neurology Journal that made waves. And this was the study. Why did it make waves? Because she dared to ask the same question that scientists once asked about syphilis. Here's the question. Do spirochetes, these spiral-shaped bacteria that make up syphilis and Lyme, persist in the brain and cause late-stage disease? For syphilis, that question was controversial for decades. Doctors saw dementia, paralysis, and psychiatric illness, but they weren't sure if the bacteria itself stuck around. It wasn't until 1913 that researchers actually found the bacteria that causes syphilis, called Treponema pallidum, in the brain tissue. Okay, that proved the persistent infection of Treponema pallidum, and it showed that it caused late-stage neurosyphilis. And that discovery changed everything. Now, we can actually go into some historical references here. There's a lot of speculation that the neuropsychosis said to have occurred at the end of World War II with Hitler was related to neurosyphilis. That's been a going narrative for a while. So just to give you an idea, there's lots of impacts across many famous people who have been linked to neurosyphilis, including, the horrible dictator from Germany. So, but this is a really important thing. So the fact that it did persist in the brain and that was proven just changed everything. The 2012 Miklossy review then asked the same question about Lyme. It said, could the same thing be happening with Lyme disease? There are many species of Borrelia. I see so many when I test, and it is shocking. Sometimes I'm like, I didn't even know that was a thing. I'm looking up things constantly when I see lab tests that have bacteria in there that are Borrelia species that I'd never heard of before. It's kind of shocking. But Borrelia burgdorferi is considered if you have to have that to technically have Lyme disease. If you have other forms of Borrelia, there are a few others that are relatively considered secondary types that they might consider making the diagnosis of Lyme disease with. But for the most part, it stands with Borrelia burgdorferi. So that's what we're looking at, specifically that species. Could Borrelia burgdorferi persist in the brain just like syphilis and drive late-stage neuropsychiatric diseases? Wow. So let's see what the review found. We found a few things. Okay, the review was really cool to reread because it goes into history. The main things that we found were there's some clinical parallels, of course, between Lyme and syphilis. Both diseases have an early, middle, and late stage. Okay, we called that the acute, disseminated, and tertiary. If you're in medicine, that is what you're trained to understand. Acute means it's the immediate, and syphilis, it's the chancre, and Lyme, it's the bullseye rash and the flu symptoms that you have for a few weeks. And then the disseminated stage on both of those result in just random, seemingly unconnected symptoms. Sometimes it's just my neck hurts all the time. My joints hurt all the time. My stomach hurts. I get rashes. I'm depressed. And they come in different phases. So then you get listed with all these diagnoses. You get listed with, depression, and then this, and then that, because nobody's connecting the dots that these are all related to a disseminated phase of Lyme infection. That stage can persist. The studies say, I think the book says, anywhere from a year to 15 years can last a long time. And then poof, it moves to the nervous system. And I remember in my medical training, I was super crazy nerd when my friends were doing their electives in plastic surgery because they wanted a job there. As a PA, I was doing my elective in nephrology because the nephrologists are like the ultra nerds in medicine. They really understand physiology super well. I was so overwhelmed, but I was doing rounds for my nephrologist in the hospital. And I remember on every patient that he was consulted on, he would order a syphilis panel. It didn't matter if they were 90 years old. Okay. So I thought that was a very interesting thing. And I kind of took mental note of it. And then I remember him talking about, syphilis can be disseminated across many decades and then poof, they get neuropsychiatric changes in their 80s, and it impacts their kidneys. So I thought that was really interesting. But in syphilis, we have the similar phases: that beginning, middle, and end, or late stage. And in Lyme, tertiary illness with Lyme disease is linked to cognitive decline, mood disorders, seizures, and even psychosis. PANS PANS in your kids, the pediatric autoimmune neurologic syndrome. So the clinical picture, she made these parallels in the study to show that the clinical picture is parallel, like between the two. What was interesting, though, is we also looked at some objective data. She actually looked at pathology evidence. So, your pathologist takes your tissues and looks at them and names them and describes them and says, this is X, Y, and Z. This is cancer. This is normal tissue. This is not tissue. This is not normal. This is infection tissue. Like, these are blood vessels. These are supposed to be there. These are not supposed to be there. Your pathologist, your other ultra nerds in medicine, by the way. So the study reviewed pathological evidence as well. And what was interesting here was that just as syphilis caused meningiovascular disease, fancy term for blood vessels around the meningi, those are parts of your brain, which is basically stroke-like damage. It also caused meningoencephalitis, inflammation of the meninges. The same patterns were documented in Lyme, same exact pathological findings on the tissue samples. Borrelia burgdorferi has actually been cultured from brain tissue and cerebral spinal fluid of patients with dementia and progressive neurologic diseases. So the translation here really comes down to that the bug has been physically found in the brain. There are many, many other studies on that, but we're just going over, this is the 2012 review that she said at this point in 2012, that's what she saw. Okay. And then she talked about like kind of the persistence and the immune system evasion, like it avoids the immune system. So essentially Borrelia was shown to evade your immune system. And I think we've talked about that a little bit on other podcasts and how it does that. But it's a very clever, it's considered one of the most complex bacterium on the planet. So it can evade the immune system. It can hide inside of cells. It can change form in order to survive. And that makes it very hard to detect, number one, and treat, number two, and just like syphilis was, and certainly before antibiotics. So the main point here on the persistence and the kind of the immune evasion was that it's a slippery bugger, and that explains why late-stage symptoms can show up even after an earlier infection, and you wouldn't have connected the dots necessarily. So the big conclusions from this 2012 study by Miklossy was that chronic or late-stage Lyme borreliosis is real. It's a real thing. It parallels neurosyphilis. I've said that a lot, but now I want you to see the review and the studies. Again, you can find that study below in your show notes. So parallels neurosyphilis. The parallels to neurosyphilis are too strong to ignore, and persistent infection can indeed explain some of the reasons why patients develop long-term neurologic and psychiatric issues, illnesses. So that was 2012. A bold claim. Lyme is walking the same path that syphilis once did, and we may be underestimating its impact on the brain. But science keeps moving forward, right? That is the nature of science. So if you ever hear science is settled, run the other way, because they are lying to you. We're never going to have perfect understanding of everything. We're going to do our best, and science should be giving the best answers it can with the information it currently has. It should never be said to be settled, unless it truly is like gravity, right? Gravity's settled. You drop a rock and it's going to land on the ground. However, I digress. So what have we learned since 2012? I want to review some of these newer studies, and I hope this is not too boring for those of you in the audience who don't necessarily read studies all the time. But I think it's important to emphasize the real situation, because I think that in the community of Lyme disease, a lot of people get kind of gaslighted, and the narrative on both sides is loud. Chronic Lyme is not a thing, and there's a whole reason why that doesn't get recognition in the medical community, and you get a side eye from people, even neurologists sometimes. And then in this community, chronic Lyme is a thing. Like, where's the science? Where's the literature standing on the situation? And I understand there's limitations on literature, and we've talked about that before. So we take it and we think through it. And that's what I'm hoping you guys will do today. So the newer studies, let's talk about those. We have one study in 2021. It was a systematic review. And it also, so a review just looks at, looks over the research that's been done. It's not like a double-blind placebo-controlled study. So it compared neurosyphilis and Lyme borreliosis again head-to-head, and its key findings showed that both spirochete infections, both of those bacterial infections, had overlapping clinical pictures. By this point, though, diagnostics had improved, and today, I can find a Lyme infection based on peptides in the blood that is very old. It's certainly improved, but there are some studies that in conventional medicine will do that is very specific, very, very strong specificity, and that's when you test like spinal fluid. So some of the diagnostics that they were using in the study was spinal fluid testing that picked up on something called CXCL13, which is a chemokine, meaning it's a chemical messenger, inflammatory messenger. It basically signals your immune system to release B cells that are activated inside of the central nervous system. When high levels of CXCL13 are found in the spinal fluid, we consider that to be a very reliable, very specific marker for active Lyme borreliosis, so Lyme in the side of the nervous system. And this gives you a real-time snapshot of the inflammation inside of the brain and spinal canal, spinal cord, because that's a little different than serum blood testing, from which is what I do. We do blood testing, and though that's specific to the infection, it doesn't prove it to be actually in the nervous system. I think your nervous system symptoms are typically enough for me, but that's all I gotta say about that. So the review, though, cautioned against overdiagnosis and unnecessary long-term antibiotics in patients labeled with, quote, chronic Lyme without a strong diagnostic evidence. And I would agree with that. I don't particularly think long-term antibiotics is a great thing, because a lot of times you need it for like a year. So, and I imagine most people here in this audience understand that you take antibiotics for 3 months to a year, especially the type needed to treat Lyme, which is doxycycline. The impact is massive and profound on your body and immune system. So what does this study mean for you? It basically shows that medicine is moving forward towards sort of precision diagnostics, sort of separating the true active infection from post-infectious and unrelated conditions. Now, in 2024, which is even newer, there was another review, and that paper looked specifically at neuropsychiatric and cognitive symptoms related to Lyme. And the findings essentially showed that even after the infection clears, those type of symptoms can persist. So depression, anxiety, anger, frontal executive dysfunction like planning, focus, decision-making are common. I have seen this in my personal life. People with Lyme borreliosis have a very difficult time being adaptive in new relationships, new experiences. They are not flexible. They become very neurorigid. So delayed diagnosis obviously will worsen the outcome, and the longer Lyme goes untreated, the more severe and long-lasting the brain effects are. That was what that study concluded. Wow. So the takeaway from that study was that timing matters. That is huge. I say it a lot in this podcast. Order and timing is important. You don't go shooting at things when you haven't prepared the area to shoot those things down. So timing is really important. The earlier Lyme is recognized and treated, the better chance of avoiding chronic brain involvement. And I know if you are in this audience listening and have had Lyme disease or chronically dealt with Lyme disease, you know how hard it is to get a good diagnosis and recognition early. It's hard. So there was another study that came out. That was April 2024, and then there's a study came out in September of 2024. It was on post-treatment Lyme disease syndrome. Post-treatment Lyme disease syndrome. So we were reviewing this phenomenon that happens in about 10 to 20% of patients treated for Lyme disease. It says 10 to 20% reported lingering neurologic or cognitive symptoms even after standard antibiotic treatment. So the big question is, well, is the infection persisting, or is there something else? The study kind of leaned toward that Lyme causes chronic immune dysfunction and inflammation, and after treatment, that is what leads to that post-treatment Lyme disease syndrome, not actual live persisting bacteria, which is interesting. It sort of shifted the focus from, instead of adding more antibiotics in and recommending that, it says to treat, the study recommended, based on the research they found, that treating immune dysregulation and brain inflammation was the crucial piece to be done. It's a big pivot in treatment, a big pivot in the approach to Lyme, recommending treatment shifting from bug killing to healing in the aftermath, that type of thing. So it's a big change in kind of even the mindset around Lyme and post-Lyme. So there was one more study I want to cover because it was this year, and it's the most recent work comparing patients who had treated Lyme borreliosis with the general population. And what they found was that even after effective Lyme treatment, many patients reported a much lower quality of life. They said that they reported many persistent symptoms that were real, but again, not due to active infection, at least not identifiable active infection. And the bottom line from this study was that symptoms can persist, but our approach to treatment had to expand beyond antibiotics alone. So this is an interesting, these studies had some interesting takeaways. So if we are dealing with, say, for example, I'm going to go back to the study in 2024, if it said its goal was that, the outcome of that study said that we needed to shift our focus from more antibiotics to treating the immune system dysregulation and brain inflammation. Well, how do we do that? If we need to treat immune dysregulation and brain inflammation, well, if we want to try brain inflammation conventionally, we're going to do some corticosteroids or something like that. But that doesn't fix immune dysregulation. That just makes it even worse, right? So how do we do that? We don't have tools in our medical arsenal that I know of that do both of those things well, treat immune dysregulation and brain inflammation. And the other research study from this year, the lower quality of life, the symptoms, how do we treat that? This is a big question that kind of is left lingering, right? So where does it all leave us? The 2012 review argued for persistent infection. Okay, so that 2012 review said that there was infection that persisted beyond initial treatment. But the newer studies kind of admit that the lingering symptoms are a real thing, so chronic Lyme is real. But they often frame that, instead of infectious, they frame it as a post-infectious, immune-driven, and inflammation-based problem instead of persistent infections. Where is the truth? I bet you it's somewhere in between. Okay, I approach Lyme as somewhere in between. We still address the Lyme and the chronic Lyme and treat it as if it's there, while also supporting the immune system and reducing inflammation. So all those studies leave us with the reality that there is still hope. Okay, that doesn't mean we have no hope. It just means there's more opportunity to use some holistic strategies. Hey guys, I wanted to pop in here in the middle of our episode just to remind you to pick up Stephen's book about Lyme disease. It's called Kids Get Lyme Disease Too, One Boy's Story About Trusting God Through Lyme Disease. This is a book, even though it is a children's book, with beautiful illustrations for kids and written in language that kids can understand. I want you to see these illustrations. Amazing, right? Those illustrations are amazing, and the book is written in child's language, but it is really one that is designed for anyone to pick up and anyone to be encouraged by. The reason Stephen wanted to write his story is not because he wanted to draw attention to the fact that Lyme really wrecked his life at a young age and gave him a really difficult time. Made it hard for him to walk and play and all the things that kids do. But he wanted to show that his journey of what he learned about himself, and most importantly, what he learned about the Lord through his journey through this process. And he was very proud of it. He just really wanted everyone to hear. So this book was written by both of us, but it is his story and his story to share. So I really want you guys to pick it up. And if you have picked it up or are picking it up, please make sure to do a review on Amazon. So you pick it up, you're a verified purchaser, please give me some stars. I don't care if they're 2 or 1 or 5, but just give me something. And if you can't, even better, would you just leave me a note in there and tell me how it blessed you or how you hated it? Either one. I would love either of those, preferably if you liked it. And the other note I'm going to make now is just to let you guys know that my other book, my book is coming up, my baby, that I've been working on for, I would say, 2 years. It's been brewing in my brain, and the research has been going on for that long, for sure. Pen to paper started in January of 2020. The research and the citation references and everything has been going on long before that, at least a year before that. So I want you guys to pick that book up when it goes live. I just want you to be looking for it, excited about it. The book is called The Quick Way Back. And it is the complete guide to navigating anesthesia and surgery safely and to protect your brain and body. So I want you guys to be looking for that, be excited about it, and it should be going live here in the first quarter of 2026. So stay tuned. So when we move toward talking about what strategies there are for Lyme disease, I mean, this is so real. Like, how many people, was it Justin Bieber? Of course, Justin Bieber, we know. Who's the other famous person recently that was diagnosed with Lyme disease? I am drawing a blank. If you guys know it, drop it in the comments. But it's another famous boy band singer. But the list is very long. I mean, Shania Twain's career came to a screeching halt because her vocal cords were affected by Lyme disease. She could not sing because of severe Lyme disease. And there are so many others. Now, I think we talked a little bit about this in a previous podcast about how, the idea that virulence increases with certain types of pathogens. At least that's the theory that was proposed in the evolutionary biology world. And when it comes to addressing, understanding disease as a virulence problem, meaning bacterial, infectious, chronic infectious problem. The point is the population of Lyme disease continues to expand because the bacterium, which is considered, again, the most complex bacterium on the planet, continues to morph and expand and adapt just like something smart does. Okay. And that's unfortunate for our bodies if we aren't careful and don't address our bodies in a way that can heal from that. It means that antibiotics are simply not the only solution. In fact, they're probably an insufficient solution. What is the solution? Okay. So, of course, I am not here to give medical treatment recommendations. This is not advice for health. You need to seek your practitioner. However, when it comes to dealing with chronic Lyme neuroborreliosis, I'm just going to tell you some of the top things that I did for my son and I do for many clients, and that is really working on very specific things. So our foundational lifestyle things include reducing inflammation from every aspect we can. That means an anti-inflammatory diet is foundational. AIP or FODMAP is really a great place to start. Make sure you're getting polyphenol-rich omega-3s, spices and herbs like turmeric. The anti-inflammatory diet. You really have to address inflammation as it's being caused in the body, and food is definitely a cause. If you are eating conventional and you're dealing with neurologic Lyme, you're pouring gas on the flame. So be sure that you're switching to an organic, pesticide-free diet that kind of follows these anti-inflammatory protocols. Okay, sleep. Don't get sleep, inflammation goes through the roof. And I know that the circadian rhythm gets disrupted tremendously in Lyme disease. It is a big problem for many people with neuro-Lyme. And so I'm not saying that just go to sleep more. I know, make yourself go to sleep. I would recommend, if you're dealing with chronic neurologic Lyme, that you do just sleep when you can for now. Okay. I would really hope that, you are working with a practitioner who helps you reset your circadian pathways and your circadian rhythm, so that you get the most benefit out of that, and you start to get the healing patterns established in your brain, which happens when you balance your circadian rhythm to the sun's circadian rhythm. Okay. But for now, if sleep is eluding you because your brain is on fire, sleep when you can. It's really important because it allows the lymphatic system of the brain to drain toxins that are stuck up there, get them out of the brain. And that is absolutely crucial in dealing with chronic neurologic Lyme. Of course, I always recommend movement. I know it's hard, and I find that some people who don't even know they have chronic Lyme, they just feel like crap. I mean, I'd like to say something. They just feel like total turd, but they just need to they're used to feeling kind of bad, and they've got things to do. They got to work. They got family to take care of. They want to keep up their standards and their appearance. I found these people with chronic Lyme have a problem with moving too much. So when I say movement, I don't mean get on your Peloton and burn it. I definitely don't mean go to a HIIT class. If you're doing those things and you have chronic neurologic Lyme, well, wow, I'm impressed. Number one. Number two, back off. Okay, back off of that. And let's just stick to walking. Walking is enough. I want you moving your lymphatics. I need you to protect your brain and boost that BDNF to really support your brain. So we do want you moving. If it's hard for you to move, do what you can and build up. I know many people are bedbound and struggle to get out of a couch or a chair or bed because they're so debilitated from Lyme. And I feel you and I see you. But in this situation, I want you to start with the baby steps. If you can't do anything but lay in bed, then I want you to start working on curls in bed and muscle contracting, and sit at the edge of your bed and do leg extensions until you're strong enough to stand and walk around the house once an hour, every hour, and then go from there. Just set small goals for yourself and just get yourself moving. Gut healing is a really important piece. If the gut is destroyed, if the gut is super leaky, which most of the time it is, you're just going to recirculate toxins if you go after bugs. You're not going to clear them, detoxify them, and all those things that are really what we're going for. You will cause more inflammation. So how do we heal the gut? We got some probiotics we need to throw in there, some fiber, food sensitivities. We need to eliminate those. We need to go support the glutamine, and other powerful herbs to restore the healing of your gut. There are some targeted supplements that you can really kind of look into for, inflammation, and our curcumins, our turmeric, our SPMs. Lion's mane is really great for some neuronal support and nerve repair. There's some really great other herbal products that you can find that support just the nervous system, which is huge. That's Go-To Cola. That's one. Bacopa, huge help for that. Ginkgo biloba. Be careful with some of the ginseng type products like ginkgo and ashwagandha, but those are really helpful for nervous system support in the right circumstances. They can help repair and protect the neural pathways. Vitamin D is critical. Antioxidants like vitamin C are super important, and you need to do plenty of herbal polyphenols. There are some very specific herbals that work very well to actually go after the bacteria. Herbs like salmento, which is an extract from cat's claw, has been really shown to target Borrelia specifically and support the immune system. I tend to like the full cat's claw extract over salmento as a targeted product, but I use other products as well. I would just make a caution here, really important. These are not DIYs. Do not go out and buy salmento and start taking it. It is powerful. If you have Lyme, you will know. If you are questioning it, you will find out. Because I have seen this prior to my involvement in helping my son recover from his Lyme. I was trying to do it by going to other practitioners, and this is a product they gave him. I've never seen him get so sick in my life. He was not prepared for it. This is why I emphasize the gut health piece. His body wasn't ready to deal with the added toxins of the die-off from the Lyme. So I don't advise you to go buy these salmento or even cat's claw if you know you have neural Lyme and do this on your own. You need to have somebody to help support you through this and prep you and kind of walk you through in case toxic load goes up as those bugs die and release their garbage. Okay. So there are, at the same time as like dealing with the infection itself with some herbal products that are powerful, remember how the studies above said that we need to think about dealing with immune regulation, balance, and inflammation. There are some herbs that definitely help in that process. Astragalus, reishi mushroom, echinacea, they are very helpful to modulate and strengthen the immune system as we are dealing with bringing the infectious burden down. So that's a really important thing. The other thing I would say is detox is a non-negotiable thing, not negotiable. Lyme recovery is complex because we are taking all this into consideration. You can't do one without the other. Yes, you can start with just simply gentle detox and gut repair, but that looks complicated too. Once we start dealing with getting these bugs out of your system, it gets more complicated because we've got inflammation being stimulated by the bugs dying, and we have to do more aggressive inflammation support. Okay, so detox is not a negotiable thing. When we clear infections, that creates debris, like I'm saying, and inflammation that has to get out of the body. I use this analogy in my upcoming book about not just do a detox. Don't just do a detox, okay? Why? It's like, okay, pick your large city near your home. I don't know if you live in Georgia and Atlanta's your home, or you live in Colorado and Denver's your home, or you live near Chicago or whatever, but pick your big city nearest you. And imagine they close all the roads except one out of the city, but then they open 10 more into the city. Okay. When you're doing a detox, if your detox pathways, meaning the way the body moves the toxin out, whether that's at the cellular level because you have weird gene mutations like MTHFR or something else, if those are jacked up and shut down and inefficient, we're basically getting a closed off pathway. We're shutting down the roads out of the city. And when you detox, what you're doing is you're pushing toxins, out of, like you're either liberating more toxins from where they're stored, like maybe they're stored in the tissues and the muscles, like lactic acid and stuff like that, or you're killing bugs that release intracellular garbage, which become toxic burden. That's something the body has to clean out through the one highway that is open. Okay. So when I say detox is non-negotiable, I mean, you first need to open pathways exiting that city before we start pushing garbage out into the city that's going to need to get out of the city. So this is a really important thing to do. So gentle, steady detox is really important. Certainly things like infrared sauna, detox bath. I'm going to do a podcast on infrared sauna, so look for that. Binders are important. A variety of binders are important. Certainly glutathione is important. It's amazingly supportive in helping you detox. You must pace it. Don't detox. Don't push yourself. Don't push a toxic detox. Be doing the gentle detoxes that start to support removing, like getting that burden down a little bit so the body can, opening some pathways so the body can handle more. And that's a process, okay? The other piece I would say is that many with chronic Lyme carry layers of trauma, physical, emotional, or the trauma of years of being just dismissed by the medical system is a very real thing in the Lyme world. You cannot be, you join any Lyme group and you'll see that. you will see that you're, and we are often in the gaslighted community. I hate using that because I don't want you to not have confidence in your medical practitioner. But it is just sort of the way that this diagnosis is set up, that it's just not something that they are familiar with and that they understand. Medical providers are really good at dealing with the problem in front of their face, but when it becomes a chronic problem that doesn't have one single solution that's pharmaceutically based, it's a hard thing to address, and it just, the system's not set up for it. Like, good luck seeing your doctor I see my clients every 6 to 8 weeks, to move from one path of the treatment to the next path and adjust and, manipulate and all this. Good luck getting that situation in a medical setting where, insurance is covering, because it's not going to do that. It's just simply not going to do it. So it's a real thing to have this sort of gaslighted experience as a Lyme to take years to get the right diagnosis. The thing with trauma is it dysregulates the nervous system. So a lot of times they find that people who've experienced trauma in early childhood are more susceptible to Lyme, and also the trauma of the experience of going through Lyme adds to the problem. So the trauma, as you know, dysregulates the nervous system. It keeps the immune system sort of in this fight or flight and survival mode. And so when you are walking through recovering from Lyme, you have got to be addressing that piece as well. And that's where it gets even more complex. Like, your primary care doctor is not going to be addressing your trauma stuff, okay? You'll be going to a doctor every other day to try to piece this together, if insurance would allow it, which they won't. So there's that. So true recovery really means addressing both the infection and the trauma story, and releasing what is held in the body so that the immune system can reset itself. And, in that process, for me, my approach is very faith-based. As a Christian, I really feel like that a really important piece is to learn that you are not, number one, that you're not alone, that God is not punishing you. Number two, that He is not absent. That he does care. Like, we get this distorted view of that, right? We believe that He doesn't love us. We are being punished. He's not good. He's not loving. He doesn't love me, obviously. He's got, why do the other people not have to deal with this type of thing? We have to rework our understanding of what we believe about God, based on not your own mindset, not your experience, but what the Word of God says the Word of God is the truth and the standard. So faith has a huge part of building resilience, not for the end of healing, but for the end of rejoicing even in the suffering, because God will take this piece from you. He will grow you. He will glorify Himself and bring good into your life, even in the midst of all of this. It's just a reminder that you aren't broken. Your body was designed to heal, and you're not alone in this process. You have a community of all of us. You have the Lord, who is very near to the broken. And then the last thing I'm going to leave you with, you do work with the right type of practitioner. Healing from Lyme requires Lyme literacy in your consultant or your practitioner. If you're working with a health consultant or a practitioner, they need to be Lyme literate, not just someone who believes in chronic Lyme disease, because there's plenty of naturopathic and medical and otherwise who believe you if you say you have chronic Lyme, but don't really know how to navigate the complexity of this infection, the immune dysregulation, the trauma, and the recovery. When the way I build my program out is to address all of those things, it is none of those pieces get missed, none of them. So that's a very important last statement I would leave you with. So, if today's episode resonated with you, if you felt seen, or you know a friend who needs some hope and needs to feel seen, pass this episode on to them, especially if they're dealing with chronic Lyme. Well, thanks again for listening in today to the Rethink It podcast, where we are changing the way the world sees brain health, one conversation at a time. If today's episode made you pause and think a little differently, be sure to share it with a friend who's also ready to take charge of their health and healing. You can find more resources, guides, and even my upcoming book, The Quick Way Back, which is going to be your complete guide to protecting your brain and heal faster after anesthesia, all at my website at beyondbrainhealth.com, because your brain was designed to heal, and together we're helping it do just that. And don't forget to follow, like, and subscribe so you never miss an episode. And in closing, please remember, stay curious, stay grounded, and stay empowered.